What if one of the most researched herbs in pediatric medicine could help your child get fewer infections, recover faster, and reduce the need for antibiotics? Did you know there is a herb that has been studied in multiple randomized controlled trials in children? And it doesn't just reduce the severity of colds, it actually reduces the number of infections and the need for antibiotics. Today, I want to talk to you about one of my favorite herbs, Echinacea, what the research really shows, when to use it, and the 5 practical ways you can use it safely and effectively to support your child's immune system. Hi, I'm Emma Sutherland, clinical naturopath, author, mum, and your host. With over 20 years in clinical practice, I've helped thousands of women and their families transform their health using evidence-based integrative strategies. Let's start with the reality. Children, especially those in daycare or primary school, can experience 6 to 10 respiratory infections per year. That's not a sign of a weak immune system. That's the immune system learning. But what we want to do as parents is reduce the severity and duration as well as the risk of complications. This is where herbal medicine can play a powerful role, as the goal is not to suppress the immune system. The goal is to train it and support it. Echinacea is one of the most widely researched herbal medicines for immune health. It works through several key mechanisms. It supports innate immune function. It modulates inflammatory responses. It's also antimicrobial and antiviral. Echinacea is what we call an immunomodulator, not a stimulant. That means it helps the immune system respond appropriately without overreacting. And that distinction is clinically important because many childhood illnesses are not caused by a weak immune system. They're caused by an immature immune system. So let's talk about the evidence here, which is always so important. A recent systematic review and meta-analysis looked at 9 randomized controlled trials in children. Here's what they found. Children taking Echinacea experienced shorter illness duration, so colds that didn't last as many days, fewer respiratory infections, fewer ear infections, and significantly less antibiotic use. In fact, antibiotic use dropped dramatically in children using Echinacea, which, well, from a public health perspective, is a major win. Avoided antibiotic course reduces the risk of antibiotic resistance and reduces microbiome disruption. It protects the gut when we don't have antibiotics. Here's the critical point. Not all Echinacea products are the same. The research consistently shows variability in outcomes depending on the species, the doses, the preparation, and the quality control. This is why professional guidance really matters, because herbal medicine is powerful, but precision really matters. I use a very specific extract of Echinacea for my pediatric patients, which is standardized or guaranteed to contain the compounds that are responsible for the immune benefits. In clinical practice, Echinacea is most helpful for children who get frequent colds, get those recurrent ear infections. They are at daycare or primary school. They seem to catch every virus circulating, or they need repeated antibiotic courses. I often recommend families begin taking Echinacea a month before winter starts and continue all the way throughout the cold months. Now, I want to share 5 practical ways you can use Echinacea safely and effectively. Action point number 1 is start early. Use Echinacea from the very first sign of illness. Don't wait. You might see a little clear runny nose, maybe some fatigue, a little bit of irritability, the mention of a sore throat, or just off their appetite. Action point number 2, use the right formula. Look for standardized extracts. Practitioner quality products are always going to be the best, and age appropriate dosing, because product quality directly influences outcomes. My preference here is always to work with a qualified naturopath to find the best Echinacea form for your family. Action point number 3, use it for immune training, not just treatment. Echinacea can be used during acute illness, or it can also be used preventatively during high-risk periods such as starting daycare, during winter, when traveling, or after repeated infections. This is about building resilience, not just supporting recovery. Action point number 4, one of the most powerful benefits of Echinacea is its potential to reduce the need for antibiotics. This matters because antibiotics disrupt the gut microbiome and they do affect immune development. So every avoided course matters. The last action point, number 5, is always work with a practitioner for recurrent illness. If your child gets frequent infections, needs repeated antibiotics, has persistent ear infections, has asthma or allergies, that's not just bad luck. That's a signal which really deserves thorough investigation. In this case, the immune system is not failing, it's communicating. It's trying to tell you what's wrong. Echinacea is not a magic bullet, but it is one of the most researched herbal medicines in pediatric immunity. The evidence is clear. It shows it can shorten illness, reduce infections, and reduce antibiotic use when used correctly. That is powerful and empowering because it gives parents a safe, evidence-based tool to support their child's immune systems naturally. If your child gets frequent colds, ear infections, or repeated antibiotics, don't just treat the symptoms. Frequent infections are really random. They reflect patterns in the immune system, the microbiome, and the environment. If you want clear, evidence-based strategies to reduce illness and build that immune resilience in your child, you can always book an appointment with me using the link below. Thank you so much for being with me today. Don't forget to like this video and hit that subscribe button. I've linked that research paper in the notes below for you to go and do your own reading.